I welcome you all. I will introduce our faculties today. Dr. Sunil Godbole sir is a developmental pediatrician, head of department Small Steps, Dinanath Mangeshkar Hospital. Dr. Alchana Kadam madam, developmental pediatrician at TDH Morris Center KM. Dr. Joyushi madam, developmental pediatrician at Saishav and Shashwat Hospital. And we are pediatricians from IAP Pune. Dr. Deepa Maitre, she is working at Navi Sangli. I am Dr. Manoj Jalte, working at Hadapsar. So again, welcome you all. So we'll start today's discussion.
Good morning, all. I would like to ask Dr. Zai, what is the definition of autism?
So, autism is basically a neurodevelopmental disorder. It comes with a selective social communication delay with repetitive behaviors or stereotype behaviors. Ideally, the screening tests are available from 16 months, but practically, the autism can be reliably suspected and diagnosed by 2 to 3 years.
And at this, what is the averages at which we diagnose the autism?
Average age is between 2 to 3 years, depends upon the severity of the child.
Okay.
How autism is changing over a period of time? Like, is the incidence increasing, or we are picking up cases quite early, or what is the post-COVID scenario? I would like to know, sir.
Definitely, we are all seeing a very rapid rise in autism, and post-COVID, it is really shooting like a pandemic, like what we thought COVID. And we were thinking that is it only because we are in good diagnostics or good awareness? Definitely, these are the factors, but still, at the back of the mind, that autism is still becoming a very grave and seriously alarming situation in the world.
Dr. Archana ma'am, what are the probable causes of ASD, autism spectrum disorder? Parents usually ask why me and why my child. That is
One of the
interesting.
challenging questions for us to answer to the parent is what is the cause, because it's very difficult to pinpoint one cause in autism. There are rare genetic conditions like Fragile X or Williams syndrome which may be associated with autism, but many times it is a complex interplay between genes, the diet, it may be maternal diet or the child's diet, micronutrient deficiencies, it can be environmental factors, it might be the gut permeability, immune activation, the viruses, so the interaction between nurture and nature, that is the genes, altering the way the DNA is modified and the protein is produced. So it's very difficult just now to pinpoint one cause.
Okay. So parents should not blame themselves.
Absolutely.
So now, Dr. Jai Joshi. So autism is called as autism spectrum disorder rather than it's called as autism. Why it is like that?
So, autism spectrum disorder or autism, it involves two components: the social communication delay and the repetitive restrictive pattern of behaviors. This restrictive repetitive pattern of behaviors, they change throughout the life. The social communication delays or the demands, they differ or they increase as the child advances. The skill sets of the child, the cognitive skills, the developmental skills, the functionality of the child differs throughout the lifetime. So, planning a therapeutic plan for the child or the intervention is very customized, and every child is unique. And so, we call it a spectrum. A child who has a lot of skills and less of social communication difficulties, uh, less of restrictive repetitive patterns, becomes more functional.
Yeah.
That is why they always say that when you see a child, it's only one child. You cannot label another child on the same child. Every child is unique and different.
Every child's cognitive ability, verbal ability, sensory issues are different.
Okay, so it's not a static thing.
Absolutely.
It's interplay of time and environment and child.
And it keeps
Absolutely.
evolving.
It's a
Yeah.
dynamic thing.
Yeah.
Like other disorders or this thing, we can't have a definite protocol for ASD. It's a customized intervention program for every child, and so we call it a
And
spectrum.
over a period of time also.
Yes, and
Okay.
over a lifetime approach.
Okay, now so Dr. Sunil,
Yeah.
usually we sometimes suspect ASD or some child development disorder, and we send the patient to developmental centers like yours.
Yeah.
So how you access there?
So it's a thing which everyone need to understand. The parents come with the child. We start with the talking and having a good interview with the parents. I think everybody should be aware there is no laboratory or imaging diagnostics for autism. It is purely clinical. So we talk with the parents, we observe the child. It's a long process. Sometimes at 45 minutes, 1 hour, we talk with them, we see how the child is performing, and then we get the basic ideas. Then we go for some standardized test, which is done by the psychologist in our department. These psychologists do all those standardized tests to define the seriousness and the associated issues with autism. Then they send the child most of the time to the speech therapist for the speech evaluation, then occupational therapy for the occupational evaluation. So it's a multidisciplinary approach in the developmental center, and then every data is collected. It comes back to us as a developmental pediatrician, and we then discuss the plan of action. As Dr. Zai has rightly said, the individualized, customized plan is decided for the child, and that is how the diagnosis is made.
Sir, I have one question. What
Yeah.
is done exactly in occupational therapy?
Let's understand occupation for the child. The child's occupation is very interesting. Self-care, play, and nowadays added part is education. So we assess on these lines whether the child is well trained on this self-care, feeding, dressing, toilet training. In play, are the child able to manage the fine skill activities, then interactive play, all those the play, and then the child is ready to read, write, and maths.
Also, in autism, you have sensory issues which overwhelm the child. So, you might need to have a sensory integration plan which helps the child perform better.
So now, Dr. Archana, usually pediatricians most of times are very busy in the OPD. So how to pinpoint or access the child you have a
Right,
suspected ASD?
right. With better awareness, I think parents come up to us with clinical features or saying my child is not speaking. So if we keep a track for red flags for developmental milestones, like for communication, if the child is not using a word with meaning by 15 months, if the child is not pointing or using gestures for need, if he is verbal, but if the child is using odd speech, repeating speech, echolalia, these are red flags on communication. On the social front, when if the child looking at the parents while he is communicating, eye contact, is the child doing hand leading, hatane khechun asking for things, is the child using behavior, and sometimes there are red flags in terms of difficulty with feeding, textures. So these are red flags on developmental milestones. It is mandatory for pediatricians. IAP recommends doing a regular screening, which is an MCHAT revised with follow-up as a questionnaire administered to parents at 18 months and 24 months, which targets 20 basic questions. Does your child point? Does your child look where you point? Which helps us identify children who need more detailed evaluations later.
The only warning sign is just mention it as a red flag. Don't label it there and there only. Sometimes it
It's a
creates a
screen.
quite panic reaction for the parents. So it's a screening tool.
Yeah, and as a screening tool, you don't have to keep on asking questions. You can give the paper to parents.
Yes.
Either they can take mark at home or in the OPD.
Yes.
We better recommend not to be given to the parents,
Okay.
because sometimes the parents both ways, either they over report or under report.
Okay.
Somebody who knows autism, if he asks the questions, then it is always better.
And
Okay.
based on the questionnaire, if you have, say, medium risk, there is another protocol with more detailed questions to exactly score it.
Usually, if we give MCHAT, sometimes the parents try to mask the
Symptoms.
and they say he's doing it. So that is also thing. It's better to have ask open-ended questions rather than whether he's doing what he is doing, how he is communicating, how he is mingling with kids, how is the situation at school, how is the situation at garden. So open-ended questions gives true information rather than directed questions.
But reliable and translated in Indian languages.
Yes,
So wonderful test.
easy to use and easily available.
So if you are suspecting, better to ask directly by a pediatrician himself or
Yeah,
herself.
it
Okay.
hardly
Yes,
takes
yes.
5 to 10 minutes. It's not a
Yes.
big time.
So now, Dr. Joshi, what are the conditions? They are sometimes they are difficult to differentiate from ASD. There are so many things are there. It's not easy to differentiate them.
Yeah, to come to a conclusion and talk to parents regarding this quite sensitive diagnosis, certain differential diagnosis has to be considered. First is alone social communication delay, which doesn't come with restrictive repetitive stereotypes, and many times it takes time to establish this restrictive repetitive behaviors, and so there is a diagnostic dilemma where there is just a social communication delay or it is going into an autism spectrum disorder. The second thing, in later age group, whether it is a pure intellectual disability or it is an intellectual disability which too comes with restrictive repetitive behaviors in some cases. The third thing, which is of practical importance or therapeutic importance, is ADHD with autism. So, the dilemma here is therapeutically which is the important diagnosis we should address. So, that becomes an important thing. The other thing is selective mutism, but here the social reciprocity and interaction in other setting is quite good. So with good conversation with parents, it is not that difficult. And lastly, to complete the list, is Rett syndrome in the regressive stages.
One, we should rule out hearing loss. And two, in ADHD, you can have just expressive language delay, which may manifest as autism, but there the intent to communicate is always preserved.
Yeah. And just add to on this ADHD and autism. Better not combine them together. The autism child, he doesn't want to talk. ADHD child is more talkative. Autism child, he moves restless without a meaning. ADHD child moves for a purpose. So combining the two is a very interesting and very, as she said, is a good dilemma to work upon.
Okay, just one question Dr. Maya Borle had asked on our Google form. What is Asperger's syndrome? Just two sentences about
Okay, Asperger's nowadays, to be very clear, as the things are evolving, DSM-5 has removed all these terms. But previously on the spectrum, Asperger's is one of the spectrum area where the child is much better. And most of the time, these children, their cognitive is well preserved. Even their speech is okay. They are able to communicate, but their socials are not good. They may have the repetitive restrictive issues which are there. And usually Asperger's, as previously to said, they used to do quite well and over in the academic performance as well. And we had just add some called as high functioning term nowadays to the same thing. I think Archana wants to add something.
Yeah. They are children who are cognitively able, and some of them have splinter or savant skills. They may have skills which are extraordinary and which would help in planning their intervention and using it as a strength.
Okay. Then we go to Dr. Sunil. Are there any advanced or experimental methods to diagnose ASD, like genetic testing or anything like use of AI?
Now, wherever you say advanced, there is always AI. So the AI is coming in the everywhere. Now, what they are doing, use cameras to have the facial recognition software. So they observe the emotional expression, the social connect on that. But I still prefer the human eyes. They're the best on the time of diagnosis. Not only eyes, hearing as well, and looking at the child. Now about the genetic, it cannot be, as I told you, genetic or imaging. They are not a diagnostic. They will help you to know the cause. As Archana has mentioned about these syndromes like Fragile X syndrome, Williams syndrome, Angelman syndrome, Rett syndrome, they are defined specific genes for that. And then if we find those genes, we can diagnose only those diseases with autism. So Fragile X with autism, yes, we can diagnose. But is there a pinpoint gene? For example, in Down syndrome, we have got trisomy 21. It is not so in autism yet. We are expecting it to come. But better not waste your time and sometimes the parents' valuable money on these higher end testing at the diagnostic part. They can be helpful for one part, knowing the cause if possible, if the child is having dysmorphic features. And second, the parents have question, what about the second child? That time the genetic testing can be useful.
Okay, so mostly it's a clinical thing.
It's absolutely clinical.
Yeah, and AI we should use for diagnosis, not replacing human intelligence.
AI can be really used to keep the data.
Yeah.
Autism, when we are managing over the lifetime, a lot of data is going to be collected. And for that, AI is a wonderful
Yeah.
use.
So I always say that AI plus human eye, that intelligence, it is super eye. We should use that one.
Absolutely.
Okay.
Dr. Archana, what are the different components of management of ASD?
Okay, now when we look at treatment, the first thing we need to do is sit down with the parents, counsel them where their child stands in terms of domains or development, what are the strengths, what are the weaknesses, and we need to have an individualized plan for every child. So we would start intervention in the form of therapies. There are varied therapies, and every child doesn't need all therapies. So there is speech therapy to foster communication. If there are sensory issues and we are working on self skills, occupational therapy. If there are challenging behaviors, we have behavior therapy or ABA. In an older child, we would want to work on group skills. So you might have group speech therapy. At a later age, social skills and academic needs, at a later age, the child might need remediation. So needs keep changing. Therapy is the mainstay. We would also want to train our parents and the family to work with the child. Medication, there is no medication for autism, but sometimes we temporarily might need to use medication in case of challenging hyperactivity or if there is self-harm.
Dr. Zai, how a child is followed up at the center, if he is coming and taking the treatment, how is the flow?
Okay, when follow-up is after assessment, the child is referred for the required therapies, and then the child is asked to come back. Depending upon the severity and the necessity, the child is called again back to the developmental pediatrician for follow-up. So this after how many months the child should be called back depends upon the necessity of the family and the child. In follow-up, again we have two components. It's the parent interview in form of open-ended question and the child assessment. The assessment is a sample behavior of the child which we assess in the clinic. So here we assess the social communication deficits, which are the core symptoms of the autism. The second thing, the behaviors of practical importance are assessed now in follow-up. We don't look at it as a diagnostic purpose. We just focus on the behaviors which are of causing practical difficulties in life. The third thing, we focus on which skills can make the child functional is in his present social settings, and then we redefine the goals, and according to the goals we decide which therapy is required now.
I'll just add one part to that. All these therapies should go for generalization. They are happening on my table. Just for example, the child learns in OT that the red block and blue block is sorted. But what is really needed? He'll needed to know how to separate a potato from onion. So that is a generalization which is important. So we need to teach the parents. Sometimes the parent become over dependent on therapist. I tell them, तूच तुझ्या जीवनाचा शिल्पकार. If the parents learn how to do this thing at home, then the results come in a wonderful way.
Also, there is a lot of focus on just academics for parents because colors or letters, that's not important. It's important to have functional skills, and we want to work on functional communication and socially appropriate behavior.
In that, what is functional functional skills for
म्हणजे
basic life?
if the child is say 3-year-old, we want to work on the child eating by self, using a glass to drink, not having mashed food, having a good routine for sleep, having activities to do outside, having a way of communication. He should start using a word with a gesture. That should be our focus rather than teaching the child colors and letters and numbers.
So that for basic things needed for the life.
Absolutely.
I tell the
Functional
parents,
skills.
what is a functional? You keep the child in the neighbor's house and go for 2 days picnic. And if that child is able to manage from morning to evening, then that's a function.
Dr. Sunil sir, what are the different challenges like you observe in the management of ASD, right from the diagnosis, acceptance by the parents, denial, all the aspects?
Absolutely, thanks to the knowledge or information overload, the parents are aware of the negative sides of autism much more. So first thing that happens, they go into denial. They just don't want to. It can't happen to my child, and there the things start. So we need to really first thing to work is on the parental activity. Then there is another challenge is typical grandmotherly approach. इसका बाप भी बड़ा होके बोलने लगा था. It started talking late. So we have to work on of that delay in that diagnosis. So the denial part we have to work upon. The delay, that is another thing which is a challenging thing. The third thing is going to this therapist. First, they need to understand the importance of it, and then converting them into a regular practice. Consistency is another challenge in management of autism, and for this consistency, for so many therapies, what always comes is a cost. So then it is expensive for the parents. It is not possible for everybody to work upon it. And then a time comes, the parents go into a way of frustration, and then you just leave the therapist there and there only. And again, there is a problem. And the last challenge I always think about is the schooling part. In the education field, the children are not well accepted by the society, and that becomes the issue. And the worst part is the society. They just try to keep the children away, and that is where we need to work upon.
Social stigma, you mean?
Social stigma is another challenge which is we have to work upon.
Are these children bullied in the school?
Obviously, children and their parents as well. So that is the thing we need to be really working. Archana.
They may be cognitively able, but they have difficulty to understand other person's intent and say socially appropriate things at the right time. So children will tease them and then they don't know what to do. So which is why social skills training for them becomes very important.
There is something called as the second hit. When the children reach in adolescence, another the adolescence and autism is a double A. It's another big challenge, and we are yet to reach that age as India. When we see this adolescent autism, it's going to be a tough time.
Yes. Dr. Archana, management of ASD and other developmental pediatrician, is it same or it is completely different?
Now, for every developmental disorder, the domain which is involved becomes important. If you have global delay, the child is going to have delay in 2 or more areas. Whereas in autism, the delay is in social communication. They have sensory difficulties, they have behavior issues, and they have difficulty with imitation. So, if you are targeting at intervention for communication, in a child with global delay, just having strategies to foster communication works. But in autism, you have to create the need for communication, which is why having a correct diagnosis helps us plan intervention. Most of the times, the behaviors, there is a reason for the behavior. It might be sensory, it might be communication, it might be adjustment to a change of schedule, which is why treatment for any developmental disorder or autism always needs to be defined with a correct diagnosis.
The specifics may be same, like speech therapy, all these things,
Yes.
but targeting our this priorities may be different.
But
And the
right.
way we administer it also becomes different.
Dr. Zai, parents usually ask what type of school my child should attend. Is it a regular school or is it a special school? Say they're in a dilemma.
So, speaking of our present condition, practically till in preschool, the child is very well supported and is quite well integrated. The real difficulties are faced after first grade. So, there are 3 things we should consider at this stage. First is the cognitive level of the child. Because autism many times comes with intellectual disability also. The second thing is the functional level of the child. Like we have spoken earlier, how independent the child is in his activities of daily living, toilet training, feeding. The second factor is transparency from parent side regarding the difficulties of the child. And the third things, taking this two into the consideration, there should be 1:1 dialogue with the school, like how well equipped the school is to support the child which the child needs. So it's not normal school and special school I would say now there are many schools which are ready to integrate the child, but the discussion should be there whether the school is able to support the requirements which the child needs over the period of time.
So it is individual schools strategy and
Yeah.
And we
And
have to rise above that schooling part. For example, I give a different example that maths, you have learned that 19 table, 23 table. How many times you have used it? But for a child with autism, learning what is 10 rupee, what is 50 rupee, that's the maths. So that is where the schooling should hit at rather than the traditional academics only. That's a life skill which training. दुनिया की जो school है, that is very important.
I think cognitive ability, verbal ability becomes if the child is able to communicate the needs, is cognitively able and has less sensory issues, it's easier to integrate the child. Whereas if the child is, there are 30% children who are minimally verbal and they may use aids for communication. So if the child is, the school is willing to accept that, then it becomes easier to integrate.
How, any advanced or experimental treatments for like stem cell therapy, Dr. Sunil sir?
Okay. Again, when there is no exact cause, there are going to be a number of therapies. We just Google that treatment or autism, and it comes to 3 billion options. So that is the way the treatments go, and everybody calls their answer is advanced. The most important thing is you have to make the child social, you have to make the child communicative, and make him independent as an individual. So for these, all these therapies come, obviously the AI will come in picture, the augmentative mobile apps are there which are helping those non-verbal kids to interact. And people are coming with fancy medicines, fancy variety of therapies, and as you all know there are variety of pathies as well. So everybody claim that we are the great. Unfortunately, we are waiting some great thing to happen, but still there is no cure, and there are some medicines which are coming up with the picture. Now about the stem cell. Again, for autism, as yet stem cell is not the answer. It is not yet completely proven. It is not accepted across them. They're trying it out. Again, I hope they should come with a miracle with the treatment. But at present moment, there is no such stem cell therapy. We don't allow that as the standard of therapy.
So parents should not waste their finances in all these things.
Absolutely.
They should focus more on the other therapies, and they should be counseled for that.
They should really work on the therapies, and on the top of it, that don't work on autism, work on the child. They start working only on autism from morning to evening, and then the whole family is in the miserable. I always comment wrongly sometimes that there are 3 or 4 autistic patients in the child. The mother is in her own world, the father is in their own world, the child is in his own world. That should not happen.
So that
Also, we should be open. When they come to us for follow up, if we are open, they will tell us. They will ask their queries about stem cell. So if we stay open and talk to them to find out what's happening at home, what are you doing, and then they will come up with the questions which are at the back of their mind.
It requires time.
yeah, many times parents ask means they are concerned about autism. I say forget about the word autism. Just concentrate what our child needs and how to improve, and don't compare with normal children.
Yes.
Means every 10% is a miracle for his life. So
Absolutely.
just go for 10%, 10%, 10%. That's all.
Right.
Dr. Archana, any association of vaccination with ASD?
Like we said, there is no pinpoint cause. So generally, features of autism are noticed by parents around 15 to 18 months, and that is the time for our MMR vaccine. So people used to implicate MMR vaccine and the thiomersal preservative in it. But recent studies that came up with vaccines which are thiomersal free, but still the incidence is increasing. So because it's epigenetic, the cause, we cannot pinpoint vaccination and as an implicating causative factor for autism.
Okay, now we'll next move to after diagnosis, management, everything. We have to train the parents because ultimately child is with parents for most of time. So how we in development center or pediatrician train the parents to take care of children at home?
okay, so parent training begins as the therapy begins. So the first part of parent training is counseling about the diagnosis. So here starts the parent training, understanding the weak, why we are saying it's a social delay, it's a communication delay, and why these are restrictive repetitive behaviors, there begins the parent training. Then with the therapies, the parents are supposed to observe what exactly how therapists are getting the things done from the child, and they are supposed to practice it at homes. That is also a part of parent training. Now, regarding pure parent training, training parent in behavior management helps a parent a lot to handle the child. The second thing which only parents can do is training parent in activities of daily living, the home skills, brushing, bathing, toilet training, sleep routine. This only parents can do. So training them in these skills is something which is very important. It's literally hand holding of the parents from the diagnosis and through various therapies, even during the even when the therapies are starting, are continuing, and then maybe at a later age, according to the child potential, the parent can take over the child and train the child, take the responsibility of training the child. Again, there are many components like the child ability and even the parent understanding.
Not just parents, the entire family has to work together.
Yeah, I just want to always ask them, are you having your we time? And I ask the parents, in last 3 months, have you gone to any joint for a coffee date? And they sadly said, sorry, sir, we can't think more than the child. If they take care of themselves, then probably the child will be able to do better. So keeping the parents' motivation and their happiness quotient up is another challenge, and we need to be really working hard on that.
So, like management part, rather than concentrating on child, we should concentrate the family and parents.
Absolutely. If the whole family is happy, the child learns faster.
Yeah. So, training them is most important part of management actually.
So when the therapy starts, how many times do you call the patient and parent?
Parents.
Like
It
once in a
depends.
week,
It
twice a
depends.
week?
Again, it depends on the severity, the resources available, the distances. People coming from long distances, they cannot come. So it depends. The model goes like that. That depending upon the resources and their severity. Sometimes we may call if the child is severe, and we may ask them to come to the therapist again and again, even sometimes daily. And on the other side, even there is a case we can that people coming from rural areas, they come once in a month, they get trained, they get motivated, and then they practice all those therapies at their home. And interestingly, they also give the same result if they are from within, ready to get trained and work on their child daily. So that is how the timing and the frequency depends.
Do you have something like that to call the parents of that
We do what
Yeah.
is like a training
multiple
program.
parents?
Yeah, I work on that program as over a year. I continue. So that's the best. If you train the parent, the things change on their dining table instead of on the consulting table.
Yeah,
That is the thing we should
because
be
I'm asking
working on.
actually the parents from multiple families and they share their experiences. That
Absolutely.
makes
When they
more.
ask question each other, first thing that they are not alone.
Yeah.
Somebody else is also parenting, and those questions will make them relax. They get connected with each other, and that helps them a lot.
They share each other's
This
experiences.
basically helps in behavior management, because what the other child has experienced behavior, the parent may experience same behavior later on, and then that perspective remains in their mind, like how I can manage now. So they get exposed to many behavioral management strategies, not just my child.
I just add one more point. When there is thing Archana was discovered the group therapy. I have seen such incident. The children were inside in a group therapy, but the real therapy was going on in the waiting room where the parents are discussing about them and having their own group therapy.
Okay. Now, so after this, many we get the patients follow up ASD and other development disorders. So how pediatrician can monitor and progress of the
I think
ASD?
pediatricians have really important role. I request to my pediatrician friend here, don't just send it across to us and forget it. Their job starts because the parent need a glue, a point where everything can be connected. So pediatrician is a wonderful person. He is connected with the parents, he is connected with the child, he is connected with the developmental pediatrician, including therapist. And at the same time, he's the main job of pediatrician, the healthcare, the vaccination part, the nutrition part, and you must be aware that there are some fancy nutritional diet therapies, and that is the thing. Sometimes the child ends up in malnutrition. So pediatrician has an immense role, and pediatrician should be the big brother or the big sister who is going to take care. Don't worry, things will work fine, and that pediatrician's one single sentence will keep them motivated.
So a pediatrician should become like a family member actually. That
Absolutely.
will work for.
Yes.
They will understand the pain and feelings.
Correct.
Sir, any role of gluten-free diet, sugar-free diet? Most of the parents ask.
It is again the now literature and research doesn't recommend any one diet, but there are some areas where, especially I personally found that this gluten, it's a free is a very difficult word. Sometimes it land up in malnutrition more than the problem. So gluten free means what the child is going to eat, but reducing these things. So instead of gluten free, what I will say, just stop the bakery products. You'll find the hyperactivity reduced. Stop the salty and chips and Cheetos. Okay, the things will become. But the child is already suffering a lot with autism, and you add a dietary suffering to that, is not a very good idea. So you have to be really careful. And if you follow a diet, it has to be under a nutritionist guidance with a proper biochemical support to that, and observing real improvement or problems in the child. Then and only diets can be tried about.
Sometimes in younger children, when you have a diet which is less on the milk or the weight, it may help not to change core symptoms but to reduce hyperactivity and the sensory issues and make therapy a little bit easier. But it has to be individualized for every child, and it is not a cure for autism.
So it's like a general good nutritious diet and
Yes.
lifestyle.
Yes.
This for universal for everything.
Yes.
It's
You
not
added that
nothing
lifestyle important part. Along with diet, if you work on the exercise part,
Yeah.
and if the child is really doing the physical activity intensely, there are all these repetitive behaviors, tantrums, aggressions, they come down. Because you are aware, the whistle goes from the cooker.
Yeah.
The cooker stays good. But if the whistle stuck there, the
Yeah,
cooker
pressure.
blows up. So that whistle with physical activity, if it is going up, the child will remain calmer and better.
Any particular sport will help them, like badminton, cycling,
It depends
swimming?
upon is the child cognitive ability about the rules of the games. That is where the sports challenges come. So the child should be in the early age, up to 7 years. I want the child to be mixing with children gradually, and simple hide and seek rules will start the child to make feel better. And then they recommend walking, running, jumping, climbing up and down. There are some good children who are cognitively bit better, and under proper guidance, swimming helps them again to calm their nerves. So that's what. Yeah, then you want to.
Regarding diet and this alternative therapy, actually investment of time by the parents should be focused more on therapies rather than these things. Otherwise, parents focus mainly on alternative therapies at the cost of what is proven to improve the child. Because time is the major investment from parents' side, along with the cost.
Now we'll move forward. What are the best and worst outcomes of ASD cases?
Now, because it's a spectrum, every child is different. But if the child is cognitively able, if the child is verbal, if the sensory issues are less, if the child has strengths which we can work upon, and if there are less comorbid conditions, if we can teach the child to understand intent of others and empathy, this child will do well. In contrast, if the child's cognitive abilities are slightly on the lower side, if the child is minimally verbal, there are lots of sensory overwhelming issues and comorbid conditions like epilepsy, the child is not likely not to do so well and may need a special school placement at a later age.
So mostly it's the parents
Yes.
how much they are
Yes.
involved.
Also,
That will
the
determine it.
earlier you start and the more regular you are, the child will do better.
Okay, then Dr. Zai, what are the chances of next child having ASD? This is the most common question by parents.
So definitely the risk when you have a first child with ASD, the risk of having second child with autism increases. So the statistical data, current statistical data says 20% of the siblings are affected with autism. Again, if the first child, the proband sex we call, the first child, if it is a female child, the risk of having second child with autism is much more. The risk increases.
Now, Dr. Sunil, parents ask, "What is the future of my child?" That is the commonest question. Will he or she will recover completely? And they compare with normal child. So how
Absolutely.
to counsel them?
So I tell them two, three things together. First thing is, as we are discussing again and again, earlier the diagnosis, better is the future. Milder the disease, better is the future. What we're discussing about high functioning or as per cognitively good children are having salmon skills. Now I'm proud to say one of my child with autism is now doing a wonderful job in a 5-star hotel. Why? What is a salmon skill? He's wonderful at making the Chinese good dishes, and he's earning his bread on that. So, the working on the life skills, the future improves. Working on knowing the seven skills, the future improves. So that is the way one should be looking at in terms of future. But yes, when it comes to but on the severe side of the spectrum and a non-verbal child by around 8 to 10 years, the future bit on the lower side. But can they become independent? Yes. Can they live their life independently? A big yes. That is how we should be telling them. And I always tell a story about the future to the parents. The children are looking at the world from your shoulders. If your future you make good, the child will continue to be in the future and the better. So one of the typical motherly question कि मेरे बाद मेरे बच्चे का क्या होगा? I tell them that you should watch Bachchan's 102 Not Out movie. If you survive till 100 years, the child will survive at 70 years. So everybody is Buddha, everybody is old. So you don't have to work about what will happen after me. So work on yourself, the future will be beautiful.
That's good.
Despite the autism, if the child can have socially appropriate behavior, communication, have self skills, and find one skill which we can train the child, I think it's the functional outcome would be good for the child.
Again, I told that first concentrate the self-sufficiency and self-care.
Yeah.
The child will
Self
survive this
skills is
self
priority.
skill.
Absolutely.
Second is whatever skills you have, we find out. Just concentrate on that. Encourage that one. Don't think about negative parts.
Absolutely. Think on the positives.
Okay, so that's all about our autism. So thank you very much for giving time for this thing.
Okay, my message is to the society. What is autism? The child cannot look at you, child cannot talk, child cannot interact, and in his own solitary zone. But now I got a question for the society. When you and me, typical people, don't talk with the child with autism, who is having autism? When we are not looking at the children with autism, we are avoiding them, who is having autism? When we are not communicating with this kid, we are also having that autism. And most importantly, we try to shun these people and want to go in your own cozy zone. We are also having autism. So my dear friends, please get connected with these children. They want connect, love and affection. The life will be beautiful. Thank you.
One, identify the child early. The earlier we work, the better the child will do. Two, we should not look for magic cures for autism. Three, with the child's autism and the core difficulties, if the child can have socially appropriate behaviors, communication, and be a rightful part of society, I think we have achieved what we want. But we still want a lot of support for the families from society. So start early, you'll have better functional outcomes for the child.
So, I would like to say the severity of the autism kids depends upon the level of support they require from the social settings in which they work. They have their own rigid ideas, rigid behaviors. It's our responsibility of the people surrounding them to be flexible in the social norms, the social system, so that they can function better with us.
I can start.
I would like to thank Dr. Sunil, the Godbole sir, Dr. Archana ma'am, and Dr. Zai Joshi for their wonderful inputs and guidance for pediatricians, how to diagnose, how to manage, and how to support them, and how to remain motivated. Thank you.
Thank you.